In this video, we are going to go over 2 great exercises to help correct lower cross syndrome. In a previous video, we talked about what lower cross syndrome is, but briefly, it's essentially a set of postural imbalances that can lead to tightness in the muscles in the lower back, tightness in the hip flexors, and then a crossed weakness of the glutes and the abdominals. If left unchecked, we can get an anterior pelvic tilt, a hyperlordosis of the lower back. It can lead to lower back pain. It can lead to hip pain. We also, in a separate video, went through some great stretches to help address some of those tight muscles that are involved. But in this video, we're going to go through some great exercises to address the weak muscles to help strengthen those so we can correct lower cross syndrome.
So in lower cross syndrome, one of the big things we want to emphasize is increasing strength in our glutes and our abdominals. So I've got Clay here. He's going to do a hip pull through exercise, essentially kind of a deadlift motion. This is to maximize the mobility in our hips while we're keeping that core locked in. So he's going to have a slight bend in his knees, and he's going to let the band pull his hips backwards. His spine is staying nice and straight. He's going to squeeze his glutes and put his feet through the floor in order to come back upright. And then he's just going to guide back into another rep. And then as he comes up to the top, we're just making sure that we're not hyperextending here, but just getting to a nice neutral point with a nice glute squeeze at the end. The next component we want to focus on is core stability and the strength associated with that. So I've got Clay here in a supine position. We're going to work on a dead bug exercise. So first thing he's going to emphasize is flattening his low back into the floor. So he's going to pull those lower ribs down, and then he's going to flatten that low back into the floor. Next, he's going to bring his knees up to 90 degrees on each side, and then arms straight up towards the ceiling. What we're going to do here, while keeping that back nice and flat on the floor there, he's going to lower one foot at a time as that opposite arm goes. Comes back to the center, switches those, but nothing between here changes. So we're keeping that core locked in, engaged, and then we can work this to fatigue and plenty of variations that you can add to this along the way.
So those are just a taste of some of the exercises that we will go through to help address lower cross syndrome. But if you are experiencing pain, whether it's in your lower back, your hip, or elsewhere, it's important to not ignore that. We have a lot of things that we can do to help correct these issues. So visit us online at TruMotionTherapy.com to learn more or schedule an appointment.